Hi, my name is Lisa. I'm the Orthopedic Program Coordinator at Sarasota Memorial. Today we're going to answer some of your top questions about what to do and how to prepare for total joint replacement surgery.
Thanks so much for being here, Lisa. So I'm considering total joint replacement surgery. What resources do you have to help me decide and to know what to expect before, during, and after surgery?
So the first resource we have is a physician referral line. So if you don't already have an orthopedic surgeon, you can call this helpline and they can refer you out to some common names. And the phone number is 941-917-7777. We also offer a total joint replacement preoperative class, and this will explain what to go through before, during, and after the surgery. We offer this class Monday and Wednesday. Monday's at the Clark Road Health Fit location, and Wednesday's located at the main hospital. If you want any more information on the classes, our phone number is 941-917-7963.
Thank you so much. I've heard the term prehab or prehabilitation. What is that?
So prehab or prehabilitation is something that your orthopedic surgeon or your doctor may recommend before you actually commit to the total joint replacement. So this is just some exercises and some activities that are going to get you stronger to help strengthen those muscles around the arthritis, so that way after surgery you have a little bit smoother and easier recovery.
Very interesting. What can I do to help prevent a post-operative infection?
So post-operative infections, there's going to be a lot of different things that we put into play. The first thing is just avoiding shaving that area for about a week or two before surgery. That way we make sure that there's no cuts on your skin before you come into the area. And also when you schedule for the surgery, you're going to come in for a pre-admission testing appointment, and they're going to give you a couple bottles of soap. Making sure you follow the instructions for the soap and really wash your whole entire body is going to be one of the first things you do. The rest of the steps we'll take care of in the hospital, but most importantly, always make sure before anyone touches your skin that they're going to wash their hands.
Is there anything I can do before surgery to help speed the recovery process?
So back to that prehab comment, really just doing those exercises and preparing and doing whatever your doctor's telling you to do, riding a stationary bike, just doing whatever you can to strengthen that area is going to help smooth the recovery process.
If I have a dentist appointment shortly before my surgery, should I still go to that appointment? I've heard that any infection, even a mouth or gum infection, can compromise the total joint.
Yes, so you want to go to the dentist before you have your joint surgery, and then you can decide after that, after your consultation with the orthopedic surgeon, how long after surgery you would want to wait before you go back to your dentist. And it's important to tell all your caregivers whenever you have a joint replacement, so that way they know any kind of precautions to take before you go in for those appointments.
What steps can be taken to prepare for returning home after surgery?
So a few things you can do to prepare home is, one, when you come home, you want to make sure you have nice clear walkways throughout your house. So anything that might trip you, a throw rug or clutter in the hallways, you want to clear out of the way. Another thing you can do is just to prepare some meals or prepare someone to come and check on you throughout the day to assist you. You're not going to be standing a long time in the kitchen trying to cook meals, so having something quick and easy to access is a big step in making sure your transition is smooth for home. And any equipment you need to go home with, we can actually provide to you in the hospital, so that's one less worry you have to prepare for.
How long does it take a joint replacement surgery to completely heal?
So that's a great question, and everybody is completely different. Usually about 2 to 3 months after surgery, you will forget you had that joint replacement, except you'll know how good you feel. 1 to 2 weeks is the hardest initial point after surgery though, so that's when you're going to be slowed down the most. After about 2 weeks though, you'll notice your activity is really returning back to normal, but you might see some swelling for up to 6 months after surgery.
Thank you so much, Lisa. This was really helpful. Is there anything else you'd like people to know before you go?
So thank you for everyone's time today. If you want any more information, you can go on sarasotamemorial.com and go to our orthopedic services page. That's where you can find some discharge videos, pre-admission videos, and also phone numbers to contact us on the orthopedic floor. So if you have any more questions, we can help you out.
Thank you so much.